И теперь я думаю, что мы все с радостью услышим профессора Чони. Он нам расскажет, почему же стоит выбирать Centurion.
Thank you. Once again, I appreciate the invitation to speak to you, and I much enjoyed the two previous presentations. I would just like to add that the Varion not only helps us be more accurate with our toric results, giving you some confidence that when you tell your patients that you're going to help them get out of glasses, you will do that, but it also makes you much more efficient. Instead of having to go to a IOL calculator and then to a toric calculator and then enter all that manually and move it up to the operating room, the efficiency in our practice has increased tremendously by having that all incorporated into one system. But let's talk about the Centurion vision system and why I use Centurion. Let's see, advance is... Next. Thank you. I've been involved with the development of the phaco systems as early on as the year 2000, when we were using the legacy system. So as the Infinity, and how many people here are using an Infinity system right now? Please raise your hand. How many have Centurion? So maybe about 50-50. The Infinity is a wonderful machine, and when the talk first began about moving to a new platform, I thought, well, there's no way we're going to improve upon what we have already. I was involved in over 5 years in the development of the Centurion, along with Dick McCool from New York and Steve Charles, the retinal specialist out of Memphis, Tennessee. And we would sit at Alcon's research lab about once a month over the 3 years, working with the engineers on how to improve the system. And each step along the way became more and more obvious that, yes, this is a tremendous, tremendous improvement. And you should be proud of one of your own, Mikhail Buchny, who is one of their top engineers, because he was very instrumental in the development of a lot of this technology, and he's a dear friend of mine. So the heart and soul of this system is its fluidics improvements. That includes a new fluidics module, FMS system, and what we will term as active fluidics. And this is the FMS system. It includes a new module with a dual segment pump, lower compliance to decrease the surge potential. It has several multi-position irrigation and vent valves, and it has, instead of your typical pressure sensors, an optical pressure sensor, which is much more accurate and speedy than other devices. If we look at the tubing advances over the years, you can see that the tubing has gone to thinner and thinner lumens, and that also decreases the compliance in the system, and therefore you have much less potential for surge. This diagram shows you the surge that is present in the old Infinity system compared to the Infinity with Intrepid tubing, and then compared to the Centurion, which is the darkest of the lines. The area under the curve, or within that curve, is the amount of fluid that essentially would flow out of the system with an occlusion break, and thus we can see we've decreased surge tremendously as we've gone on to better and better systems. This diagram also shows you the same thing in a slightly different manner, but you can see that the surge depends on the vacuum level. So with the Centurion system, the bottom line, you can go up to much higher vacuum levels and still have less surge than what you would have with the other systems shown here. So it's compared to the Infinity and to the Signature system. So these are really the components of active fluidics. Active fluidics works by, instead of hanging a bottle from a pole and depending on gravity to feed fluid into the system, we have a compliant bag inside the machine that is compressed by pressure plates that can react very quickly to changes in the intraocular pressure. So instead of setting a bottle height to control your flow in the eye, your infusion in the eye, we target a pressure in the eye. So we can have a stable pressure in the eye, a much more solid and stable anterior chamber by doing that. You can very easily set the patient's eye level because that does make a big difference in the pressure in the eye relative to the pressure in the bottle. You can vary how quickly pressure develops in the eye. How many times have you begun infusion in the eye and you see suddenly the chamber deepen and the pressure increases dramatically and the patient has discomfort? You can have that pressure rise very slowly if you would like. We also have factors of vacuum rise, irrigation factor, and incisional leak. Small little changes you can make to the system that makes a difference because all of us have different incisions that may leak at different rates, and so we have to take that into account. My current irrigation factor is set at 1.4. All of these components play into better control within the eye, more responsive the system within the eye. So we mentioned bottle height versus pressure. Most surgeons with an Infinity system would operate at a bottle height of 100 to 110. Dick McCool actually added an extension pole on his Infinity and cut a hole in his ceiling, so his bottle actually was up in the ceiling to create as much pressure as possible so he could go to higher vacuum levels. A bottle height of about 100 gives you a pressure in the eye of about 80 to 85 millimeters of mercury, probably more than you would imagine. So now instead of thinking of bottle height, we're going to try to change that mindset to thinking about pressure in the eye. So that if you set your pressure at 70, that would be equivalent to a bottle height of 95, which is probably lower than most surgeons are currently using on the Infinity system. And so you can see we're looking at IOP here, 55, if that's where we set the IOP on the Centurion system. That's equivalent to a much lower bottle height of 75. Yet with that, you'll have a much more stable chamber because of the active fluidics that's built into the system. My current settings are typically between 60 and 65 IOP, and as I said, an irrigation factor of 1.4, which gives me a pressure bottle height equivalent of about 80, 85. So you can see the pressure stability shown in this graph with the Centurion system and compare it to that with the White Star and the Infinity. Despite increasing aspiration rates, you maintain a stable pressure in the eye as opposed to what would have happened with an Infinity or with the signature White Star system. This all is demonstrated during surgery as a more stable chamber. And what about comparison to the Stellaris? The Stellaris does have the option of pressurized infusion, but in order to maintain a stable chamber, it pushes the pressure up extremely high in the eye, especially when you're looking at faster flow rates, as opposed to the Centurion system, which you do not have to artificially raise the pressure in the eye in order to have a stable chamber. So that's pretty much the active fluidics that's built into the system. What is balance energy? Balance energy includes new tip design as well as new irrigation sleeves. And we'll start by talking about the irrigation sleeves. On all of our minds as we're operating, especially with the dense cataract, we worry about heat buildup in the system and collapse of the anterior chamber or lack of fluid moving through the system. The new Intrepid tip design is a rib type of tip so that even if you have a tight incision, and we're all going to smaller and smaller incisions, even if you have a deep orbit where you're stressing or pressing the phaco tip on an edge of the incision, usually the anterior lip of the incision, you'll maintain flow around the titanium phaco tip because of the ribbing. And that helps provide a more stable chamber and better dissipation of any heat that might build up. Now, the new tip design was Mikhail Buchny's design. It looks a lot like the original Kelman tip designs, but it has a funny bend. A lot of us that worked with Mikhail on this joke that he probably accidentally dropped a tip on the floor and bent it and said, well, let's use it anyway and see what happens. And it turns out that it worked really well. But there's actually a lot of thought gone into this. The design of this tip provides for much more swing, much more power at the distal end of the tip, and very little movement of the shaft of the tip. The result is that you can actually turn your power down, and I would urge you to do that compared to a standard Kelman tip, because if you leave the power very high, it's probably too powerful and will cause chatter. So you can turn your power down and get a better result, more efficiency, with less heat buildup within the incision. So this is an example, a side view. Let me go back, please. Okay. A side view video in a floppy iris, an IFAS case. And you can see that how easily the material comes to the tip. Yet even in a floppy iris case, you have a very solid and stable anterior chamber. The tip itself feels a little more like a straight tip than a Kelman tip just because of the angles. So you will have a change in ergonomics slightly, more towards what you used to know with a straight tip. Notice how the material just flows in. You don't have to go behind the iris to find a piece of the nucleus, which is very important. It's much safer, especially in cases of floppy iris. And now we'll demonstrate the followability and the efficiency of the active fluidics combined with the balance tip. I prefer to do pre-chop for most of my cataracts and then manipulate the pieces into the iris plane. But watch how these nuclear quadrants will come very easily into the tip. We're going to have very low CDE and only 30 cc's of fluid used for a grade 2 to a grade 3 nucleus. And that's quite typical. Phacoemulsification time is very, very low. I've actually gone on, since incorporating Centurion, to a single-handed technique and not putting a second instrument into the side port. So the only direction the fluid can move to come out of the eye is through the aspiration port, or if there's some incisional leakage through the primary incision. But note how the followability with a single-handed technique is much improved, very little manipulation in the eye. So it's a very kind and gentle procedure, and very quick. And total CDE is low, and now the amount of fluid that goes through the eye is less than 20 cc's. So there should be less endothelial cell loss, less corneal swelling, especially early on. And lastly, we'll talk about applied integration, which refers to the AutoCert, which Nikolai already showed you quite nicely, and how this all ties into the cataract refractive suite. So you've seen some footage of the AutoCert. It is controlled with the surgeon's foot instead of having to manually turn an injector to inject the lens into the eye. You can select the speed. I prefer to go to a faster speed, but you may in certain cases want to go more slowly. And you can set the maximum speed, or you can control the speed simply by how far you push on the foot pedal. This frees your second hand up to stabilize the globe, and I think the video demonstrates this the best. This is a side-by-side of cases that I'm doing, comparing a manual injection to the AutoCert. Notice how elegant, how smooth the AutoCert case is compared to the manual. And here's another case. In some instances with manual, you may actually lose some visualization as you're trying to use a patient-assisted delivery method. Now, AutoCert isn't the singular reason for purchasing a Centurion, but once you've used AutoCert, you don't want to give it up. So it's very, very nice. It's sort of like GPS on a nice car, or ABS brakes on a car. Once you've gotten used to them, you probably wouldn't buy a car without them. And the Centurion is certainly part of the entire cataract refractive suite. It helps to have all these parts of the system talking to each other to improve the safety, the efficiency, and ultimately the refractive outcomes of your patients. I would warn you, just like test driving a really nice car like a BMW, you certainly don't want to try this machine unless you want to consider buying it. Because once you've used it, and that's sort of what happened in my experience when I brought it to our clinic. None of us were interested in upgrading to a new system. But once our surgeons tried it, it was something that we all of a sudden had to have. So it is a wonderful system. I think you'll like it, and it's certainly an improvement over what we've had in the past. Thank you very much.
Большое спасибо.